Hey, I am a cardiac ICU pharmacist, and I work in the CVICU and the CCU. And the CVICU is filled with a lot of surgeries that include CABGs or coronary artery bypass graft, whether or not they're replacing a valve, etc. And there's a lot of meds that get released after their operation. And let's talk about the importance of each one. And this is going to vary from surgeon to surgeon, and you'll see if you work in different hospitals or if you're a travel nurse, etc., you'll see different practices from different surgeons. But there are some core drugs that are extremely important, especially on the first day after an operation. So when they first come out of the operating room, they're typically on a number of infusions. This could be vasopressors or they could be vasodilators. And these medications are extremely important because you're very fragile after you come out of surgery. When it comes to vasodilators, there are typically two, and this depends on your surgeon, but there are typically two or three that we use in the postoperative setting, and that is nitroglycerin, nicardipine, or clevedipine. And the purpose of these drugs is to keep your blood pressure under a certain goal range, and this varies from surgeon to surgeon, but typically I've heard less than a systolic less than 120, systolic less than 140, systolic less than 130. Again, it really depends on the surgeon and their practice. Sorry for the change in scenery. I had to drive somewhere. But the next would be vasopressors, and they are super important and highly utilized because they help keep your blood pressure up if we need to use them. And the typical goal that we use is a mean arterial pressure, or MAP, greater than 65. And that can vary from patient to patient depending on the clinical scenario, but that is our typical goal. And the reasoning we want to keep your blood pressure up is obviously if it gets too low, then that could be fatal. But also it's to help perfuse your kidneys. The typical vasopressors that are commonly used after cardiac surgery are norepinephrine and epinephrine. Sometimes, very rarely, we'll use phenylephrine, but we don't like to use that in cardiac scenarios because it can increase your afterload way too much. It has no beta agonist activity, it only has alpha, so that really won't help you, especially in a cardiac patient, because they're already having heart issues as it is. So that kind of leads us into inotropes, and the two that we normally use are milrinone and dobutamine. And again, this is going to vary from surgeon to surgeon, and there are benefits to each one. But basically, the idea is that if your heart is not having enough contractility or enough cardiac output, then they'll add an inotrope like milrinone or dobutamine to help your heart contract a little bit better. Milrinone has a little bit more vasodilatory effects than dobutamine, so that can make it an ideal agent if you're having cardiac output issues and you also have a high systemic vascular resistance. However, it has a longer half-life, so it's not your typical titratable drug that comes off and on very quickly. And since it reduces your systemic vascular resistance, with that comes a reduction in blood pressure, which can already be an issue if you are just out of surgery when you got a coronary artery bypass graft. Dobutamine has a shorter half-life, like a typical vasopressor does, but it doesn't have as potent effects on systemic vascular resistance, meaning it won't lower it as much at typical doses. I'm going to end the video now and make a second part about oral medications that we use that are incredibly important after cardiac surgery, and this includes aspirin, Plavix, beta blockers, statins, etc. And these are all medications that have shown to have a benefit after cardiac surgery.